Just get you in the ambulance and just do a quick ECG.
Every 2 minutes in this country, someone somewhere suffers a heart attack. Coronary heart disease causes around 160,000 deaths each year. These are staggering statistics. And the cost to the NHS of treating coronary heart disease, well, that runs into millions.
So Arthur, what's been happening to you since I last saw you?
When businessman Arthur Edge suffered a fall, he also suspected the severe chest pain he encountered was the first indication of a heart attack.
But I think it would be safe to take an ECG just to make sure there's nothing going wrong with your heart.
His GP, Dr. Simon Frampton, was able to take his patient's ECG reading in his surgery in Ormskirk in Lancashire, rather than having to send him to hospital, using a machine only marginally bigger than an iPod.
Attached to the machine now.
Practice nurse Jane Flynn applies the 12-lead monitor.
It's actually recording ECG.
She's then able to send the results down a telephone line and receive diagnosis within minutes from the Broomwell Healthwatch Response Centre in Manchester, where cardiac specialists and paramedics can give an immediate analysis of the ECG readout.
One of the main advantages is the speed to it, but also the fact that it's backed up by experts, consultant cardiologists and highly trained nurses who read the digital ECG, which goes down the phone line straight to their computer screen. It means both a quick service and an expert service. One which we can rely on the results totally when we get them back.
This button will take about 30 to 60 seconds to record the ECG.
Hospital ECG machines can cost thousands of pounds, while patients often have to wait days for their results. But this cost-effective, innovative technology allows Dr. Frampton to make important decisions on treatment immediately.
It can save the patient having to have a trip to hospital and all the time and stress that accompanies that.
Worst of all with the hospital scenario, that you'll be waiting for the results till you go back to see your doctors maybe 2 or 3 days after. But with this system, it's immediate. You've got peace of mind within a quarter of an hour.
The patient gets an instant decision, and you don't have to send them up to the hospital for waiting around for ECGs and waiting for results to come back.
Dr. Frampton was able to give Mr. Edge the reassuring words he wanted to
tell you your ECG is absolutely normal.
Well, the feedback from surgeries, from doctors, nurses and practice managers, as well as patients, has been unanimously very, very positive. And we're encouraged by the appreciation that's been shown for this service and the use it's brought to the health service.
Are you with the baby now?
Ambulance control centres such as this one in Lancashire deal with thousands of 999 calls to suspected heart attack patients.
Just to let you know, we're bringing in a 54-year-old male with central chest pains and vomiting.
But many of them turn into non-emergency cases. Now that GPs can obtain an instant analysis of electrocardiographs using the Broomwell system, then the demand on the ambulance service and hospital beds will be reduced, thus freeing up resources for other emergencies.
I'll look out for the ambulance crew.
I think it's a win-win situation for the NHS as a corporate body. I think it's definitely a win for patients who benefit from the service. It's a win for our clinicians. It's the type of service as well that's very consistent with the government's stated intention to move more care closer to patients, giving them ready access in their community.
Broomwell's range of telemedical monitoring equipment includes personal ECG machines now in widespread use by patients who find they can apply the equipment themselves and get immediate advice or reassurance from experts.
It does show that you're having another episode of your angina, so what I'd like to do is send you into hospital.